Okay. Good afternoon and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician specializing in urgent care. I help busy professionals to find solutions for their acute and chronic medical needs. So, good morning, or good afternoon, everybody. I'm so excited for our special guest that we have joining us today. We have Dr. Stephanie Freeman. And guys, let me share with you about this awesome individual who's going to spend a few minutes with us today. Everybody in medical medicine knows I absolutely love and adore Dr. Stephanie. When I got ready to transition from being employed to self-employment last year, I got involved with medical moguls. And so one of the people that I met along this journey was Dr. Stephanie Freeman. And guys, let me tell you, any physicians listening, she is the locums guru. She has been a mentor to me as well. I have a business coach, Dr. Dreon Birch, but she has also been such a great help and service to me in the transition from being employed to being self-employed. And so she taught me a lot of great information, a lot of great tips. Love Dr. Stephanie, but I'm going to let her tell you more about her. She is a girl raised in the South, which I absolutely love, but I'm going to let her talk more about, tell you who she is, because I could talk about Dr. Stephanie all day. Dr. Stephanie, thank you so much for joining us.
Dr. Celeste, thank you for having me. I'm super excited to be here. I am Dr. Stephanie Freeman, your double board certified critical care physician, and I work with physicians who are struggling with their jobs, burnt out with their careers, or who just want some career advice. Through their books, webinars, coaching, and speaking, I help physicians discover alternative jobs and careers in medicine so that they can practice medicine on their own terms. Like Dr. Celeste said, I'm a critical care physician. I travel all over the country to help provide critical care services to hospitals on an as-needed basis. So I'm super excited to be here and to just be spending some time with my favorite Dr. Celeste. So thank you so much for having me.
No, thank you so much for being here. And guys, she's being modest. Dr. Stephanie is extremely well trained, but she functions in ICUs all over the country, west to east, east to west, north to south. Dr. Stephanie's in a different city and state every week at a time. And so I thought it would be valuable to have her come on and share some of her information from her perspective about COVID-19 and about social interactions and the things that she thinks from her experience having taken care of patients over the last 4 months since we've been dealing with this pandemic. And of course, she's been practicing for how long, Dr. Stephanie? I'm sorry.
Oh, as a critical care physician, 14 years. I graduated from medical school 20 years ago. So I've been in the game for a while.
Okay, awesome. So I thought it would be great to bring her experience to us and share with us some of her thoughts about how best we can navigate this COVID-19 challenge that seems to be rearing its ugly head again. And we just want to share valuable information that can help everyone make the decisions that are best for them and help mitigate the risk of spread of COVID-19. So I thought our first question would be, and we have some people that are logged on. If you guys have questions, definitely write those questions down as we go. We'll have a few minutes at the end to answer some questions. So, Dr. Stephanie, first question I'd like to ask you to share with us. Living here in Birmingham, I've seen a lot of different things over the last several months in terms of wearing of the mask or the cloth covering. I know that our audience is out there. Some of them have shared with me their frustration, their concern with being out and not seeing individuals wearing masks. Our mayor here in Birmingham, Mayor Randall Woodfin, actually passed an ordinance in the city of Birmingham to make it so that you have to wear a mask, which I think is I think that's, when he did that, I was literally on the other end like, yes, simply because I know how important wearing that mask is. So now I'd like you to share with our audience, if you will, and this is from a critical care physician. So guys, this means that she's intubating people. She's seeing the people before they're intubated. She's taken the tube out and taking care of them afterwards and discharged these people from intensive care units. So no better expert to tell us why is the mask important, Dr. Stephanie?
Well, the mask is important because it decreases your risk of spreading this virus to other people via your oral pharyngeal secretions. And that is why it is important that we wear a mask or a face covering, because as studies have shown, a lot of people who are infected with COVID-19 may be asymptomatic. And we all know that human nature being such, even people who do have symptoms don't necessarily stay home and take measures to protect other people like they should. So therefore, the CDC has recommended that all people wear a face mask or face covering when out in public. Therefore, it decreases your risk of transmitting something to somebody else because it blocks, it keeps your oral and respiratory secretions to yourself. Meanwhile, and it also kind of decreases the risk of you receiving, getting in contact with somebody else's oral and respiratory secretions as well. So that's why it is so important that we wear a face mask or a facial covering when we are out and about in public. And touching back on what Dr. Celeste is saying, I do take care of critically ill patients. I've taken care of patients who have COVID and patients who have a severe form of COVID-19. This is a disease that is an absolutely devastating disease. Absolutely devastating. We have seen nothing like this in American medicine. And a lot of people think it's overkill when we physicians get on here and say, be careful and wear your mask and all this kind of stuff and social distance, because you guys don't see the other side. But those of us who take care of these patients and see the other side, see how physiologically damaging and devastating COVID-19 is in its severe forms. And people who do survive this and do require mechanical ventilation, sometimes they are on the ventilator for months. There was just an article that came out about a gentleman who was released from the hospital after 2 months, and he received a bill of $1 million. And in those 2 months in the hospital, he spent 30 days in the intensive care unit, a whole month in the intensive care unit. This man was actually lucky to have survived, but I've seen people who have been in the intensive care unit for 4 weeks, 6 weeks on the ventilator. And if they are able to be transferred and discharged from the hospital, they still have to go to a rehab facility. So the trajectory of this disease is not days, it's not weeks, it is months. And the case reports and the stories we have coming out of China and coming out of Europe and coming out of Italy, that people who survive this, their lives are forever changed. Their bodies can be forever changed due to the severity of this disease. So that is why it is very important that everybody do what they can do to decrease their chances of getting COVID. And if they have it or have been exposed, they need to do the right thing and do what they need to do and decrease their risk of transferring it or exposing other people to this horrible disease.
Oh, okay. Awesome, Dr. Stephanie. Awesome. So you alluded to, and you actually kind of went into my next question, which was discussing some of the trends with COVID-19 that you see. And you said that you have seen several patients that have been on the vent for 30 days at a time. And you talked about that it changes their entire life. Can you share with us just a little bit some of the post-ventilator symptoms, body-wise, perhaps?
Oh my God, right. I am not a physical medicine and rehabilitation doctor, but I can tell you that the people are not the same when they survive. If you have somebody that's been critically ill for 4 weeks or 6 weeks, the body changes in such a way, they, especially if they need mechanical ventilation and supplemental nutrition and all of the host of things that it takes to support a critically ill patient. These patients are not the same people that they are when they come in, both physically, physiologically, emotionally, mentally. It really just alters your whole body. And if you are lucky enough to have survived a severe course, your rehabilitation needs are going to be great post-hospital discharge. And it is going to take an extensive amount, a lot of times an extensive amount of rehab and coordination with the physical medicine and rehabilitation doctor just to help regain your muscle strength. If you have suffered from severe respiratory failure as a result of COVID-19, your pulmonary function can be severely decreased. So you may have to, engage in forms of pulmonary rehab. If the COVID-19 affects your cardiovascular system and you have sustained heart damage, you may need some cardiac rehab. So all of these things, and what people don't realize is that the post-acute phase of a severe COVID-19 infection is a prolonged phase that still requires active rehabilitation and active care under the guidance of a physician.
Wow. So it sounds like, because some people might think, oh, I got COVID-19 or someone got COVID, because some people aren't hearing the stories and the things that you hear and the things that I hear. So it's not a simple thing of, oh, I got COVID-19. I was down for a week or two, but then that was it. It has the potential to affect your life for several months, it sounds like you're alluding to, for those patients that end up hospitalized and in the ICU.
So if you got COVID-19 and you are only down for a week, you should be thanking God for that. Okay. I know a lot of my patients get COVID-19 and are sick for a week or 2 weeks at home, and then they get worse and come to the hospital even after having progressive symptoms for 2 weeks. And usually any other viral illness, after about 7 to 10 days, it should have run its course. But the thing that's so insidious about COVID-19, SARS-CoV-2 virus, is that thing could just be getting started after 14 days. And, and so therefore, if you've had COVID and you've had a mild form of the disease, you are blessed and highly favored. But for those of people who get COVID-19 and progress to a moderate or a severe form of this disease, it is a life-threatening disease. And the thing to remember, and I think that this is the message that we all need to adhere to, is just because it's not in the mainstream media right now, because we're reporting on some other things. Just because the economy is beginning to open back up, and just because you're seeing stuff on social media about people going on vacations and eating out at restaurants and having all these, gatherings, and it seems like life in certain instances is returning back to normal, do not be fooled. COVID is still with us, and COVID is going to be with us, and it is going to be a public health emergency for the next 2 years. So you've got to continue to do your due diligence and to be prepared. Okay.
Awesome, Dr. Stephanie. Thank you so much for that. You actually just brought up one of the main points that we kind of chatted about and that I'd like for you to share. So Dr. Stephanie just shared with us, guys, that, hey, COVID is not going anywhere. It's going to be here until at least next year when we have a vaccine. And, these are things that we've kind of discussed here on our show in discussing the important details of COVID-19 and, when are we going to get over it? When is it going to be over? And Dr. Stephanie shared, just because you see a lot of things happening on social media, that there's a need to address the issue. Okay, we know that we need to stay at home. We know that staying at home is the number one way to decrease the risk of spread of COVID-19. We've been at home at this point for 4 months. However, everyone is making an individual decision about their family and about what they will do. And you're making a decision for your family. So let's talk about how can we be as safe as possible? I know that there are people that have asked me as patients. I've even had friends to ask me, what do I do about this? Do I need to cancel my wedding? Do I need to, I have to go back to work to be able to feed my family? What do I do? What about the kids? They've got to go back to school and get an education. I don't want them to not progress and propagate as a student to get that done. There are people that have milestone birthdays that they, want to celebrate. My bonus baby had one just the other day. And so let's talk about how we can be as safe as possible if we make the decision, because at this point, everyone is making a decision that's individualized to them, because as we all know, there's a second pandemic that's going on right now other than COVID-19 that we are as a country are dealing with. And so in that vein, what can we do to be as safe as possible if we feel like we've made the decision to leave our home to attend a wedding, to go to go into a cookout with friends? If you're going to do it, do it in that way. And that's kind of been my entourage as I've spoken with different people that ask, should I go out to protest? Should I celebrate? Do I still get married? What do we do about this situation, about church? Can you share with us, Dr. Stephanie, how can we be as safe as possible?
Right, absolutely. In terms of parents making the decision to send their kids back to daycare, to summer camp, and to school, I think the key is just to have open conversations with the facilities and the organizations to which you will entrust your child to see what their policies and procedures are. Because you're right, you can't keep your child home forever, but there are specific things that these daycares and schools can do to decrease the risk of COVID transmission in the organization. So the thing is, as a parent, you need to get their guidelines and their procedures in terms of their drop-off procedures, their pickup procedures, how they're going to screen the students, how they're going to screen the staff members. Have there been any known exposures right now? How are they going to make sure that their environment has been sanitized and disinfected? How are they going to deal with meal handling and food preparation? So in terms of sending your child back to daycares and back to schools, you've got to see what the schools and the daycares and the other organizations are going to do to keep your child safe. Now, let's talk about weddings. I'm not going to tell anybody to cancel their wedding, but there are other things that people are doing now. People are still having weddings, but they're having Zoom weddings so that their guests attend via Zoom. You can have these things, but you have to be mindful of the CDC guidelines for gatherings. You also need to make sure that it's at a venue big enough to allow for physical distancing, and your guests really do need to wear masks. We are in a pandemic, and when people see your pictures 20 years from now, they're going to know that this was the 2020 COVID pandemic. And yes, people had face masks on. So see what you could do to make it more fashionable and stylish and bling up the face coverings, but they do need to do that. You do need to make sure that you have hand sanitizer readily available. Or if you choose to have a wedding reception, you really need to think long and hard against having a buffet. It needs to be single serving, single plated, no shared utensils, because those are things that are going to be that you need to implement in order to keep your guests safe. Because I don't think that anybody wants to have a family celebration and as a result of the family celebration have to live with the guilt that people got sick at your family celebration. So therefore, everything needs to be altered with public health and safety in mind. Same thing with going back to church. The days of shaking hands, high-fiving your neighbors, giving each other hugs, those days are gone. Period. Your church the sanctuary needs to be big enough so people can physically distance. You especially need to wear a mask and a face cover if you're going to be singing and praising and shouting and hallelujah, saying hallelujah like a lot of us like to do at church, because all of that projects your oral and respiratory droplets and secretions, and that increases the risk of transmission. So therefore, our church services are going to have to change. Choir may become a thing of the past, because we know that there are known cases of known transmission of COVID-19 in church services and choir rehearsals. Now let's talk about, we just had Memorial Day, and the increase in cases that we are seeing right now is as a result of the Memorial Day activities that we saw 2 weeks ago. We're going to see an increase of cases due to the public protest. 4th of July is coming up. Am I telling you not to go to a 4th of July cookout or barbecue? I'm not telling you that. But what I am saying is you still need to implement and practice safety, So personal safety guidelines, you still need to wear a face covering. I know I'm from Alabama. I'm an Alabama girl. I live in Houston. It's 11 degrees out here. But let me tell you what's worse than being uncomfortable in a mask is what's worse than that is having COVID, because even a mild case of COVID is still painful and uncomfortable. So you still need to wear a mask, a surgical mask like one of these, or a lot of times people have the really cute cloth mask or the really cute facial coverings. You need
like this one.
Yeah. Like that. I've been seeing the face mask, and I want one of these that has the little straw opening so you can have your mask on and still sip your, your drink. You still need to have that. You still need to physically distance, and you cannot hug your long lost cousin. And you really need to think twice about hugging grandma and your elderly family members, because you don't want to be the one to give them COVID.
Right.
So, like I say, days of handshakes, fist bumps, and hugs, we can't do that anymore. Now, in terms of eating and food preparation, avoid buffets, because these shared utensils are a source of transmission of germs. We really need to avoid shared food, avoid shared plates, avoid shared utensils. So everything needs to be single plated, single serve, if it can be individually packaged, and avoid shared utensils. So avoid anything that can increase the transmission of this virus. And so I'm not saying not to participate in these things, but you have to, if you choose to participate, you need to do it in such a way that maximizes your personal safety at that moment.
Okay, awesome. Dr. Stephanie, thank you so much. Thank you so much. You're giving us such good bullets and pieces of information on how we can safely navigate interacting socially and what's safe and how to help keep us safe. I did want to ask you this one question, your opinion about one of the things that I've encouraged my patients to do is that if they are going to get together with family members, with friends, is to definitely keep it at 10 people or less. And I've talked a lot about outdoors versus indoors. If you can hit on that, and in addition to that, I know that we've seen greater percentages of COVID-19 in certain populations and cultures, that being African American and Hispanic. So can you hit on that for me in terms of indoors versus outdoors and ventilation, that piece, and the tie-in with those cultures being affected as African Americans as well as Hispanics, and seeing a high percentage?
Right. So social gatherings, if you have to go to one, of course, outdoors is always better because it's just better ventilation in the outdoors, and wherever you can physically distance, the greater. So, I have no problems with people attending social functions in the outdoors. You guys are spread out, you're physically distancing from each other. That's actually better because, the wind's blowing, the ventilation is better. So outdoors is always better than indoors for obvious reasons. Now, in terms of a COVID-19 disproportionately having a higher mortality rate in African American communities and Hispanic American communities, comes down to one thing. And basically, to be honest with you, it comes down to racism. And I'm going to tell you why. Because we have to look at the social determinants of health that put these communities at increased risk. Studies have shown that people with the highest mortality rates from COVID-19 are people who have medical comorbidities such as hypertension, diabetes, heart disease, and obesity. Well, hypertension, diabetes, heart disease, and obesity impacts African Americans and Latino communities in greater proportion due to social determinants of health, not having abilities, not having access to healthy foods, because a lot of people live in communities that have, food deserts because, they don't have access to grocery stores. A lot of Black and brown people don't live in communities that have access to primary care physicians. So that's a huge reason. There is no genetic reason why COVID impacts one group of people versus another. It is all social, and it's all social as it pertains to the racial disparities of health in this country. Being able to stay at home and socially distance and physically distance and social isolation is a privilege, because the vast majority of people who had to work during this entire pandemic, who are the essential workers, are people who are Black and brown. So just think about it. Every time, you made a run to Walmart, what color was the checkout person? They were Black. Every time you made a run and you ordered something off for Amazon and it was delivered by the UPS or, FedEx, those workers are Black. Every time I traveled the entire time for my job, and every time I went to a hotel or somebody, the workers were Black or brown. So the essential workers who were not able to stay home, who were deemed necessary, more often than not, are people who are Black and brown. The transportation, so in the transportation, food industry, healthcare industry, construction industry, all of these industries that were essential, the people who are running, who are working from literally out working, are people who are Black and brown. So therefore, they got repeated exposure to higher SARS-CoV-2 levels, and therefore they are the ones who ended up getting sick. So when I was out of state and working in Wisconsin, first when it started hitting in March, early April, most of the people who had SARS-CoV and COVID got it from occupational wise or exposure in healthcare. So the workers, the patients who were Black, they got it from working in nursing homes, long-term care facilities, being personal care aides. The patients, the Black patients who had it, got it from being in a nursing home or a long-term care facility. The thing that I saw with my own eyes, which was really, really eye-opening to me, was when I went back to that same facility a couple of weeks later, the demographics had totally changed of the patients who were hospitalized and were sickening in intensive care for COVID-19. It went from being a predominantly Black to then being predominantly Hispanic. And that coincided with these outbreaks that are going through the country in these food processing plants. So all of the Hispanic patients that we saw at my particular hospital where I was working got exposed to it at work in the food processing plants, or they took it home to their family members. So you had Hispanic people who are 30 and 40 years old, who are healthy going to work. And then the next thing you know, they are on the vent on ECMO because they got it from a work exposure. So that's why when I say that the disproportionate impact of COVID-19 on Black and brown communities has less to do with nothing to do with any genetic differences.
Right.
To do with that, it's all based on racial inequalities in this country and how those social determinants of health end up playing out in terms of which segments of the population experience the medical comorbidities that make succumbing to COVID more likely. Those segments of the population who do not have the ability to isolate themselves and their families from exposure. And that is what we're seeing. And if you couple that with the horrendous lack of testing that was available in the Black and brown communities. So we're not testing. People are getting exposed. They're not being tested. They're not being isolated. They're not being quarantined. And then therefore, it's just a never ending perpetual cycle. And that is something that is, it's the perfect storm with everything that is going on. Like you said, we have the COVID pandemic and we have the civil unrest due to the racism pandemic, and the COVID pandemic as it pertains to how it has disproportionately impacted Black and brown people is a direct correlation of the social determinants of health, which is what every Black physician has been sounding the alarm for since you and I have been in medicine.
Exactly, Dr. Stephanie, you preaching today.
Just saying.
But that is so true. And then when I think about that, I wonder about, do you remember in the first few weeks that we were dealing with COVID, that there wasn't an ordinance for people to wear masks in public? Do you remember that?
The thing is that
I was the whole
this is the thing that is so frustrating about this. And this is where I can say unequivocally, our country has been a complete failure, because we were looking for guidance from our leaders and we didn't get it. Exactly. Because infrastructure was totally taken away from us and we didn't know it. So as physicians, we were dealing with information that was literally changing moment by moment by moment by moment. Back in January and February, oh, there's no need to wear a mask, but a lot of people bought the mask up anyway. So then healthcare workers couldn't get masks because they were all gone. And so now, so I can only imagine if I'm frustrated as a critical care doctor, because literally, guys, this is what I do. Depending on where I go to work, I go in and I go to the ICU and I talk to the full-time doctors that work there. And I say, what are you guys doing here at your facility as it pertains to this, this, and this? What are you using for treatment today? Do you have this, this, and this? And because everything changes every day, depending on what's available, the latest information, and where you're located. So if we physicians are frustrated, I can only imagine the conflicting signals that the general public is getting. Like early March, the president was saying it's a hoax. Now people been locked down for 4 months. Then people think that, okay, we're opening back up, so this thing may be going away. But then Dr. Celeste and Dr. Stephanie are like, no, honey, it's not going away. So it's a mixed message that people are getting. And no wonder the country is tired. Yeah. No wonder we're tired.
Right. No wonder we're tired. And we definitely are tired. And yes, you alluded to that. Yeah, we as physicians are definitely frustrated, especially if you're an African-American physician. And knowing how we typically practice medicine and how we've been taught over the last 18, 20 years to practice medicine, and having to adjust that because of the lack of adequate PPE or personal protective equipment to help protect us and to help keep patients protected, and the lack thereof of that happening. So thank you so much for sharing that, Dr. Stephanie. And helping to bridge the gap so that people see, because it does come across as a mixed message, and it's kind of challenging because here we are in the middle of COVID-19 and everyone is accustomed to us as physicians being able to say, okay, you have the flu, so we know how to treat the flu with our eyes closed properly, with our eyes closed easily. But the flu has been around and we've been treating it for 20 years. COVID-19 is a strain that just came around. That's why it's novel coronavirus. And so we're learning things as we go. But the one thing that's been a mainstay has been the use of that mask and utilizing it to kind of help protect us and how to help mitigate the risk of spread of COVID-19. So thank you so much, Dr. Stephanie. Now that leads me to my next question.
Can I just add something right quick?
Oh, sure.
The mainstay of COVID is prevention. Prevention. Because we have no treatment. There's no treatment for COVID.
Thank you, Dr. Stephanie.
No treatment for COVID.
Because people ask me all the time and they're like, oh, Dr. Celeste, I saw it on the news. They said this is a treatment. I'm like, there is not a treatment for COVID. There's not a treatment.
So Plaquenil is bullshit. Excuse my French. I just needed to talk about that because, people's president are still pushing that. But the Plaquenil azithromycin combination is trash. It does not work. There is no treatment for COVID. Maybe the remdesivir may have shown some benefit, but those are for people who are critically ill with COVID-19. And, that still depends on whether it's widespread availability. There are some other medications that we use, convalescent serum and Actemra, but there is no treatment that is a silver bullet for this thing. It is all supportive care. And once you progress to respiratory failure and other multi-system organ failure, your mortality rate skyrockets. So there is no treatment for this.
Right.
No, there is no vaccine for this. So the only thing that you can do is to do what you can to protect yourself. Prevention, 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 prevention. And then let's talk about these increased numbers. So let's say you do get sick and you do need to go to the hospital and they do need to admit you. You best hope and believe that they have hospital beds and ICU beds available, because these numbers are increasing. As of today in Jefferson County, there were 2,509 cases with 118 deaths. Montgomery, 2,830 cases with 69 deaths. And to the layperson, that does not seem a lot. But for the COVID cases that have to be hospitalized, these people are in the hospital for a long time. So what we physicians are looking at is not just increased cases. We're looking every day at hospital capacity. And we're getting real nervous. I don't know what you guys are thinking about in Birmingham, but I'm in Houston and I'm in our physician groups, and this chatter is like, okay, these bed capacity, we're about to reach it. And there's talk of opening back up that field hospital at NRG Stadium that they had opened up and closed down a couple of weeks ago. They're looking at these numbers. So that's where the concern is capacity to care for people who are ill with this disease, and hospital capacity to care for other people who get sick and continue to have their medical issues outside of COVID. That is what we physicians are trembling in our boots right now, because we don't want to get to a New York City situation. We don't want to get to an Italy situation in which the medical infrastructure just buckled under this weight. But if our numbers continue to increase the way they're increasing, and if the hospitalizations continue to increase and the ICU utilization continues to increase the way they're increasing, we are going to have to do something. I mean, I saw on Facebook yesterday that doctors in Tuscaloosa were like, hello, DCH doesn't have any beds, people. I saw 2 weeks ago when the doctors in Montgomery were like, hello, we're down to one bed. So if Montgomery was sending all their patients to Birmingham and DCH didn't have any beds, and where those patients go, they're going to Birmingham. What the F is Birmingham going to do when Birmingham is taking all of the patients from everywhere in Alabama?
Right. Exactly.
This is going to be a problem.
A huge problem, which is why prevention, as you stated, Dr. Stephanie, is so, so, so important. And that's on my street. I'm a preventative girl all the while. Because there are things that we can do to help prevent us from getting it. And some of those things include wearing that mask if you leave your house. If you leave your house, wear the mask. Keeping the 6 feet distance if you leave your house. Making sure that you're doing things like, and you can share with us, Dr. Stephanie, really quickly, how big of a role that you feel building your immunity plays in this, in terms of you. And in fact, I can't believe I forgot that. Oh my gosh, I forgot this.
Oh, and let's not forget hand sanitizers, y'all. Just so you know, hand sanitizers are coming back. I've seen them in the shelves at my Kroger down the street.
Right.
Bring hand sanitizers with you and sanitize and wash your hands every single time. Take your Clorox bleach wipes with you all the time. Wipe stuff down all the time. And even when you're interacting with people, the key is to maintain enough physical distance. Always, always, always assume that everybody has COVID until they give you proof that they don't. Now, getting back to what Dr. Celeste was saying, how important is it to build your immune system? It is very important. This is a time that if anybody has ever been motivated to get healthy, this is the time to do it, because you increase your risk of succumbing to COVID-19 if you have diabetes, high blood pressure, heart disease, or you're overweight. And most of us are overweight. Overweight means a BMI of 26. That's everybody in the country. Just about everybody has high blood pressure. We just don't know it because we haven't been to the doctor. That's why y'all need to go see Dr. Celeste. Most people have diabetes. I'm pre-diabetic. And I had to make some lifestyle changes and get on some medications because my primary care physician was like, look, you either get this under control now or it's going to be an issue. So this is the prime time for whatever lifestyle changes and medication changes that you need to make in order to get your diabetes under control, get that blood pressure under control, get that weight off, to make sure if you have heart disease that it is well controlled. Right. This is the time to do it, because if you have any of those conditions, you get COVID and it can take you right on out of here. So that's why it's extremely important. Going back to prevention, you need to be in the best health you can be, right, to give yourself the best chance of surviving this thing, building your immunity, eating right, exercising, getting sleep, all of this stuff. This is not the time to be putting your body under any increased stress. This ain't the time for it. This ain't the time for it.
Right, right. So, Dr. Stephanie, share with us, please. You are an ambassador for Peloton.
I am not.
Amazing. Oh,
yes. I am a Peloton enthusiast.
Okay.
I love Peloton.
Okay. Well, I know that you ride your Peloton fanatically, okay, and you inspire all of us to continue to stay healthy, building our immunity. And I have no doubt that that's one of the things that allows you to healthily enter ICUs across the country, treat patients that have COVID. Mm-hmm. And guys, you got to remember, she's directly dealing with those secretions when she's intubating someone or extubating. That means putting that little tube down their throat, putting it in and taking it out. She's the person that does that. And so, but here she is sitting with us, Dr. Stephanie, takes very good care of herself. And one of the ways that she does that is through exercising on her Peloton. And I'm sorry, I thought that you were a Peloton ambassador. I'm sorry.
Oh, it seems like I am, because I'm on that.
All of us should be.
And it's all I'm talking about is Peloton. And so many people have joined my Peloton group and they bought Pelotons using my code and everything.
Right.
My trainer was like, listen, I go work out with her. I got my Peloton gear on. She's like, really?
Awesome.
But yes, I'm a Peloton enthusiast. And the reason why I love that bike is because a lot of times we use not having time as a reason to not exercise. But if you can exercise in your house, throw your exercise clothes on, throw your shoes on and go exercise. That's what is a very integral part of my life, because now, like I said, I was talking to my business coach and he was like, because even he got Pelotons as a tons plural.
Oh, he has more than one.
Huh?
I didn't know he had more than one. Wow.
Pelotons plural.
Okay.
He's not going back to the gym because a lot of people don't feel safe going back to the gym, going back to the prevention, sanitizing. Is your gym equipment clean? Do you feel comfortable huffing and puffing next to somebody on this treadmill next to you? So a lot of people have decided that they're not going back to the gym, so working out at home. And I think that's great. And that's one of the things I have always done, because I just did not have time to go to the gym. So I got a bike, I go get on my bike, and for 45 minutes, all is right in my world. So, yeah.
Okay, awesome. That definitely is inspiration. And I'm so glad that you mentioned that about the gym in terms of sharing, tips there and going to the gym. I know that I myself, we have a gym, and it's a, relatively small gym in terms of the number of people that come there. But I've been waiting until a last slot wherein I can get in there by myself. And, I'm in there with my Clorox wipes, my Lysol. They're like, okay, here comes Celeste. They know it, right?
Right.
And I usually am able to work out there independently on my own. But that was a question. I know that one of my cousins asked me, okay, how can I go work out? Because they want to work out and be healthy, but going to the gym poses a risk. And I think it is important that people know that. I know that one of the things, that a lot of gyms are encouraging people to do is to make sure you bring your own towel. And Dr. Stephanie, I already shared with you guys those same little wipes I've been obsessed with for years. Everyone should be obsessed with those now, and use those when you go out, just wiping stuff down. People that know me and have known me for years know that that's, I was a little bit of a germaphobe. And I guess I still am. But one of the things, I keep wipes with me all the time. And so now is the time where we all should keep them with us. We all should keep hand sanitizer with us, buy an extra hand sanitizer for your car, so that you never are without it. Buy an extra mask for your car so that you're never without it. I think those things are important. And just one last question, Dr. Stephanie, because I know that we're close to the time, but the one thing I would like you to share with us is, in some people deciding to go out and be socially interactive with others, and preferably a small group, how important is it to know, if you can, someone's status, and not their HIV status, but their COVID status, because COVID-19 status is a thing now.
It's the thing. Yeah, it is the thing, right? So the thing is, and I'm single, and I'm in a lot of physician groups for single physician women. And the question always comes up, what are y'all doing about dating?
Stephanie, yes. Tell us, what do you do a special on it? But I mean, Dr. Stephanie,
right? How are we supposed to meet people if we're socially distancing? So that's where, online and Zoom stuff. And I've heard of people doing Zoom dates, but sometimes you just need to meet people. But here's the thing. Just like in the age of sexually transmitted diseases, and we were all taught that you have to assume that everybody has it, and you have to protect yourself. And it's no longer taboo when you're, about to be physically intimate with somebody, asking them about their HIV status. It's no longer taboo to say, like, hey, I'm going to get tested. You need to go get tested. Show me your test results. It's no longer taboo to ask people to wear condoms or to bring your own condoms to protect yourself from sexually transmitted diseases. We have to start looking at COVID-19 in the same way, because right now there's treatments for HIV. There's treatments for sexually transmitted diseases. There are no treatments for COVID. You see what I'm saying? So therefore, we need to assume that everybody has it. And then we need to assume how we're going to protect ourselves from it. And then if you're in a situation in which you want to be more physically intimate with somebody and not have to physically distance and wear a mask, and you want to do all this other kind of stuff, it is very reasonable that you ask that person to get tested for COVID-19. But here's the thing to always remember, that even if somebody gets tested and is negative, if they have the disease and it's early in the course, it can still be a false negative. Somebody can get tested and be negative, but then still go on to get exposed to it later. So those are things to keep in mind. But I really think that now it's going to become a thing to start asking people for their COVID-19 status and asking for proof, because that is how you're going to be able to protect yourself. We can't spend the next 2 years not dating. We can't do right. We can't, continue to physically isolate ourselves until the vaccine becomes available. We can't do that. But what we can do is to consider asking people for proof of their COVID-19 status. And once again, if you live in Birmingham, go to Dr. Celeste and let her test you for COVID. So you can be like, I got my COVID test, see, I don't have it.
And I literally have a girlfriend, my sister, who does that. And she, was tested. And it's like, I got my status. I'm good. Are you, she literally says that.
You better be asking people like, y'all go out on a date, you better get your little thermometer. And just like when you go into the hospital, they scan you. You might just need to be sitting across the table, scanning somebody. Right. You got to ask, do you have fever? Have you been traveled out of the country? Have you been exposed to anybody with COVID? Have you, but we've got to, now we've just got to ask those questions, because we really do have to protect ourselves.
Exactly. Yes. Thank you, Dr. Stephanie. Great points. Guys, you heard what she shared with us. Knowing your COVID status is important. And with the exchange of bodily secretions and fluids that go along with dating, and whether you're going to be intimate with someone, all those things, that's something that's very important to know, because just like HIV is something that can kill you, we know that COVID can kill you as well. So having knowledge of your COVID status is something that's very, very, very extremely important, especially before you decide to be socially interactive with someone, especially if you're dating. if you're dating, guys, for everyone, of course, but especially if you're dating and going to spend time with that person. So it's 10 minutes till 4, Dr. Stephanie. I don't want to hold you up much longer. I so appreciate your taking time out of your busy schedule. But so it looks like we have, a couple of questions.
Okay.
That's okay. So, and we have a lot of people that have joined us. I'm going to just hit the questions though. So, and this is my husband who's asking this question, Mr. Willis. He's asking, how can those in urban communities better protect themselves from exposure? What tips for mass transit? And I think what he's talking about is when you're dealing with a situation where you're in a tight space or less ventilation.
That is the reason why New York got hit hard, Chicago got hit hard. That is the reason why there have been deaths from COVID, from EMS workers, transportation workers, because they are essential workers, closed conditions, people coughing and gagging and spitting on them, and in some cases assaulting them by coughing on them. So they've had repeated exposure to high levels of COVID. So the thing that they need to do, this is not the CDC, but if you are in an urban area or you are in a high risk profession, meaning that you are coming in contact with a lot of people in closed spaces, if you are, a transit driver, Dr. Freeman, would be wearing an N95.
Right.
I would not even be wearing one of these. I would be like, y'all need to get me an N95 and have it fit tested. And then I would push for them to retrofit those buses so that they have a partition between the driver and the public.
Right. Like plexiglass?
Plexiglass, yes. And they need to either put more buses en route so that the number of people having to ride each bus decreases, or they need to do stuff like change how people can enter the bus. So instead of like when I travel and I'm in these airports and I have to get the rental car shuttle, they don't let you enter by the driver anymore. They make you enter the middle door away from the driver. So there are things like that they can do. Okay. But the urban areas, the transit drivers, the transportation workers really honestly need to push their employers to provide adequate PPE. And in those situations, I would personally insist on an N95 that I have fit tested for. And I would personally ask for them to erect physical barriers, plexiglass, to protect me from the public.
Okay, awesome. That is an awesome answer. Thank you so much, Dr. Stephanie. And just for our viewers, that N95 is a different mask.
Yes.
Right. If you'll hit that, Dr. Stephanie, just a little bit.
Right. So this right here is a surgical mask, and this is designed to prevent the wearer. If I have this on, this is designed to keep my secretions to myself. Now, an N95 is a respirator that filters air particles because some of the COVID-19, the SARS-CoV-2 virus can be aerosolized. Mm-hmm. And so therefore it can be transmitted by particles in the air. And in order to protect yourself from that, you need a respirator mask on, like an N95, to filter that air coming in. And so that's why I say that if you're in one of these high risk jobs, you kind of need to be pushing for an N95 that you are fit tested for. And what do I mean by fit tested for? That means that you are tested. You go to occupational health and they give you a mask and they put you under this hood and they put the aerosols in to make sure that the mask is properly filtering the air. That is what all healthcare workers need who are working in high risk environments, and other people who are working in high risk environments. If you are EMS, and like I said, and I don't know what the CDC says, but I just know for my own risk tolerance, if you are EMS, you need to have an N95 because COVID presents in so many ways. A lot of people are asymptomatic. So even the screening questions don't pick up. 50% of people who have COVID-19 don't have fevers. A high amount of people who have COVID-19 are totally asymptomatic, but you are interacting with people, close up with people. All of my first responders need to be walking around with N95s, period, point blank. And that's just me, Dr. Stephanie, talking. But for my, right, I got my own N90, I got my own stash of PPE because I'm not convinced that the recommendations coming out in terms of PPE is based on what's correct as opposed to what's expedient. So I'm just saying,
get an N95.
Better is better. Better is better. More protection is better. If you are a first responder, first line, somebody that is working with the public and they are breathing on you in a confined space.
Exactly.
Yeah.
Okay. Okay. Thank you, Dr. Stephanie.
And
thank you so much. We have another question. What are some early symptoms of COVID-19?
This is the thing. I think a lot of people may have had it and may have been exposed to it, but didn't know it because the symptoms can be that of a common cold. You know, sore throat, fever, runny nose, itchy eyes. But what does that sound like? Sore throat, fever, runny nose, itchy eyes. It sounds like allergies.
Right.
You know? So how do you differentiate? You don't know. Early symptoms, a lot of people say that they had like a horrible sore throat. Fever. One of the things that is pathognomonic for COVID-19, meaning that if you have this symptom, you have it, is loss of smell. So if you wake up one day and you can't smell, you got it. Loss of taste. That is indicative of an active COVID-19 infection, loss of taste and loss of smell. But really, because it's a respiratory infection, it's a respiratory virus, it's a respiratory illness. Any symptom of upper respiratory illness, it could be that.
Exactly. Exactly. Which is why it's so important for us to do what Dr. Stephanie told us with the first question, with wearing the mask, because you can be now. And so, Dr. Stephanie, you recall on, I think it was Monday, when there was a news conference, and a member of the WHO organization shared, it's very rare to have spread of this infection when you're asymptomatic. So your thoughts about that? And I already know what you're going to say, but
Right. I don't
you saw the debacle that caused for a few days.
Right, it did. And they ended up walking back that statement. And I think that statement was probably taken out of context.
Correct.
Because you have the whole issue of being actively infected, being asymptomatic versus being pre-symptomatic.
Right.
Yeah, no.
So,
and it's just another cause of frustration that we physicians have because, you get these studies, these people saying something, then there's a soundbite, and then there's a headline, and no wonder the public is confused.
Exactly. And they're like, wait a minute, but you all have been telling us for months that it can pass asymptomatic. Right. And then
we're like, we shut the whole economy down for 3 months, and now they said, no.
Right. Like, we've been sitting at home for 3 months for no reason. You mean you all told us? And it's like, feel. Yes, you can spread it asymptomatically.
Right. But you know what? What I think is that most people who have COVID have symptoms. They just don't attribute it to COVID.
Right.
That's the key. Most people have symptoms. They have a sneeze. They have a runny nose. They have a mild sore throat. But they're thinking it's allergies or just a regular cold when it's probably COVID.
Right.
We're going around saying that they're asymptomatic, but they probably just haven't recognized the symptoms or attributed to COVID-19.
Right. Exactly. Thank you, Dr. Stephanie. Okay. So we've got Dr. Dietrich is on. Hi, Dr. Dietrich. Thank you for joining us. She says she'd like to know your thoughts about rapid testing and permitting people to enter places.
I think in order for us to continue to get a handle on this, we're going to have to rapid test. We are going to have to. The thing that has really been revolutionary to me as a critical care doctor over this past month is the availability of that rapid PCR test, because early in the pandemic, it was taking 5 to 7 days to get the back because the test had to be sent out to a reference lab. Mm-hmm. Now, inpatient, depending on where you are, you can get that PCR test back in 3 hours, and in some instances, 90 minutes. So that right there has been a game changer. And I think that in order for us to better mitigate the spread of this disease and to better understand its spread and its transmission, we got to have widespread, rapid testing of a larger amount of people in the community. And so I have no problems whatsoever with us, with different places saying, hey, we need you to have, a negative COVID test. And this is the kind of COVID test we need you to have. And so then that way, if your COVID test comes positive, we can take other steps to maybe do some contact tracing.
Exactly.
Ask you to isolate yourself, monitor your symptoms for 14 days, but rapid testing and effective testing and widespread testing is going to be a cornerstone in dealing with this.
Right. Exactly. Thank you so much, Dr. Stephanie. So you would actually encourage business owners to make sure that their staff is negative prior to reopening.
If that's something that they want to do. And I think schools may have to go that route as well too, because I'm just thinking about all these major colleges that you're going to have 25 and 30,000 people converging in like 2 months. How are you going to keep track of that?
Right.
All over not just all over the states, not just all over the country, but maybe even, internationally when international travel opens back up. So just like whenever, you go to school, whenever you go to college, whenever I apply for hospital privileges, they want proof of vaccination or they want proof of immunity. I just have to be revaccinated for hepatitis B because my hepatitis B titers were low. And so just like you're going to have to show proof of all these childhood vaccinations you got and some adult vaccinations you got. And then I always have to show proof because how I work and what my job I do, a yearly flu vaccine. I have to show proof of a yearly TB skin test or quantiferon test. I think we're going to be moving towards the fact that essential workers and healthcare workers are going to have to show proof of COVID-19 negativity, or if you're COVID positive from the PCR test, getting further testing with the antibodies or symptom management or things of that nature. I think it's going to move to that.
Okay. Awesome. Thank you, Dr. Stephanie. So we have a couple of other questions if you have time. Do you have time?
Yeah.
Okay. I have time. So, and this is actually my sister asking this question. What steps should we take when ordering out from restaurants? Hey, Harley.
So what steps should we take? So when you go to a restaurant, if you choose to dine in, I have no problems with that because I was seriously thinking about going to this BJ's right down the street from my house.
Uh-huh.
I caught a lot of flack on doctors groups.
Right.
That just so you know, because they're like, why do you need
Right. Yeah.
And I want to go out to eat. It's okay. So once again, take your wipes and your hand sanitizers, wipe down everything, the table, wipe down the menu, wash your hands. Mm-hmm. The key is, and I'm not that necessarily concerned about, restaurants because they've been allowed to stay open the entire time. The dining rooms have just recently been allowed to reopen, but I have no problems with well-prepared food that is brought out. Each person has their own food. Do not share a plate with anybody. So no shared appetizers, no shared utensils, single serving, single plated food, and you'll be fine. And just take the recommended. And like I say, try to physically distance from the next group of people over. Just try to physically distance. And if you can sit outside, if they have outdoor seating, that's better than indoor seating. But yeah.
Okay. Thank you so much, Dr. Stephanie. That has been a huge question, I know, here in Birmingham. Can I go out to eat? Can I not? I know that my bonus baby's here, and it was her 16th birthday on Thursday. Right. And so she's here visiting us from Austin, and it's her 16th birthday, which is a huge thing. And so we're like, what do we do? Because they've been held up in the house for the last 4 months. So we were able to find a restaurant that had outdoor seating. And of course we were masked up, but definitely physically distant from other individuals. So, and I definitely agree, sitting outside definitely is a better option. But just keep in mind what Dr. Stephanie said, if you are going to go out to a restaurant, and making sure you take your wipes with you and you have your mask, and that you make sure that your seating is appropriate, as Dr. Stephanie has suggested to us. One more question. So, and this is my mom, Dr. Stephanie. It's on here. They're the ones asking the questions mainly. So she said, docs, do you find patients 60 and over have more severe post-COVID-19 issues? Yes.
Thank you for saying that. Thank you for asking that. Yes, ma'am. Yes. Age is a risk factor for mortality in COVID. And that's why my mama is still on lockdown.
Right. Exactly.
Can't go nowhere.
Right. Exactly.
My mother asked me permission to go places.
Right. So can you say that again? Because my mom is listening. Because she don't ask me for permission. Although my sister lives with her and is a physician, so you know, doesn't know their influence.
Yeah, my mom is on lockdown for that very reason.
Right. Right.
So age is an independent risk factor for higher severity of illness and higher mortality with COVID. And absolutely. So that's why my mom is on lockdown.
Right, right. And I share with my mom to make sure that if she's going to leave, which she rarely does, but making sure she has a face covering. And I know she just ordered some from one of our favorite boutiques that makes masks, or that has been supplying us and our family with mask issue, by the way. So thank you for that. One more question. LaDonna Collins. Hi, Ms. Collins. Thanks for joining. She said, what does the antibody test entail? What are you looking for in the test?
Right. So the antibody test, that's excellent. So you have two types of tests for COVID. You have the PCR, which is the polymerase chain reaction test, which tests for the actual presence of the viral RNA. And then you have the antibody test, which tests for the antibodies. So the PCR test can tell you if you're actively infected, because the presence of the viral RNA from the SARS-CoV-2 virus. The antibodies tell you whether the presence in your blood, and it tells you whether or not you have an active infection or you've had a previous exposure to it. So they're two different testing kind of used for different indications, but a lot of people like to get the antibody test just to see if they've possibly had it and possibly been exposed to it. You know, you've heard this going around, people saying, you know, I got really sick in February, and you know, it's negative, and I had a cold this bad, and I wonder if that could have been it. And so a lot of people have been searching out like those antibody tests to see if they had it in the past. So that's kind of where they fall out, the difference between the two testing. In the hospital, you'll get the PCR test, the nasopharyngeal PCR test.
Okay, awesome. Another question. So this is Miss Paula Swanson. Hey, Paula, thank you so much for joining us. She said, I may have missed it. What's the best way to determine good COVID testing sites? I'm hearing that all COVID tested sites aren't FDA approved. Does that make a difference in accurate testing results?
Yes, it does, because there's been a flood of counterfeit tests, you know, and you just got to be careful. So I would always recommend that you go to your trusted primary care physician and let her guide you in terms of that, because now there's a lot of like people who have no business doing COVID testing, like people who are day spas are now offering that shit. Really. You got people who are estheticians who 1 minute are tattooing your eyebrows and in the next minute saying, hey, I can test you for COVID. No. Stick with a reputable physician and let him guide you in terms of the appropriate COVID test for you.
Okay. Awesome. Thank you, Dr. Stephanie. Thank you so much. Let's see. Okay. And so we have one more question here. Miss Kim McDaniel. Hi, Miss McDaniel. Thank you for joining. She said, am I too late to ask about someone with lupus and Sjogren's on top of high blood pressure, sleep apnea, asthma, working every day in an office setting? So she has lupus, Sjogren's, hypertension, sleep apnea, and asthma. And she works in an office setting. How can I nicely keep coworkers away? Oh,
Tell me
good.
her face. No, just kidding. You can't say that, but you really can. Because listen, wear your mask and be like, listen, I need you to give me physical distance.
Mm-hmm.
I mean, this is the time in which political correctness needs to be out the window. This is your life. You're immunocompromised. SARS-CoV-2 can kill you. People play too much. They know they're not supposed to be in your physical space. Ask them.
Right.
You don't have to tell them, because that is a life or death. And you have to wear your mask. And technically they should be wearing one too. Exactly. And the thing that I got, and the other thing that you have to do, be hyper vigilant about disinfecting your workspace. I mean, every time I get up from like my work computer, I'm wiping everything back down.
Right.
When I go to work in the ICU, the first thing I do is I find me my stash of wipes. And I go around that unit and like, where's my stash? I like the purple top, you know, wipes, and I keep it by my desk, and I'm always wiping my stuff down. So you have to be hyper vigilant about always cleaning and disinfecting your workspace. You wear your mask. Get a surgical mask. You wear your mask and insist that people get out of your space. Now let's talk about workplace etiquette and workplace environments. The office break room is disgusting, you know, and I say that with love, because the break room in the ICUs where I work is disgusting, because people don't clean up after themselves. People have food. We're still having potlucks where with some of the places where I was working, people are still bringing food for people to share food. That has to stop in the age of COVID. And a lot of employer workspaces and office, break rooms and even staff break rooms, they're small. People are having to sit around a table and eat. And that is a place where transmission of COVID can be very high. So you have to be vigilant in terms of making sure that all of your workspaces and work environments and places you go while you're at work are safe. So it's nothing for me to walk into the break room, find that Clorox spray, wipe stuff down, know. It's nothing for me to do that, because you're keeping yourself safe. And it's nothing to ask somebody to please give me my 6 feet. I mean, you know, this is a time, political correctness. We're not shaking hands anymore. We're not hugging anymore. And this is a time for tell people to give you your space.
Exactly. Thank you so much, Dr. Stephanie. Thank you. You've given us so much wonderful and great information that I hope that the audience that's listening and anyone listening, please feel free to share this information. Please share this with your family and friends and coworkers. As Dr. Stephanie is an expert in critical care, she's an expert in taking care of COVID-19 patients since this pandemic began, 20 years before that of experience in the intensive care unit. Managing multiple people, and she's been doing that over the last 4 or 5 months that are positive for COVID-19. So please take the recommendations that she's made so seriously and share it with other people. We want to thank you, Dr. Stephanie. You know that I love you, adore you. If you can share with us, though, how can we get in touch with you, and how can they follow you?
Yeah, follow me on Facebook at Dr. Stephanie ICU, and check out my website at www.drstephanieicu.com.
Okay. Thank you so much, Dr. Stephanie. So guys, I hope that was helpful for you guys. We are going to let go now. And I know, Dr. Stephanie, it's like 15 after 4. We've been on here for an hour and 15 minutes. And I bet we probably would keep you on here for another few minutes if...
I'll have to come back.
Yeah, if you would be so kind as to come back, we definitely appreciate it. You're genius. You always have always impressed me since day one when I met her at our Medical Mogul Conference. I'm super impressed with Dr. Stephanie and her genius and what she's been able to accomplish over the last 20 years, serving people across the entire country in critical care. So thank you so much, Dr. Stephanie. Guys, you know who I am. I'm Dr. Celeste, your board certified family medicine physician. I help busy professionals to find solutions for their acute and chronic medical needs, both through my concierge medicine program, virtual medicine program, as a national speaker, and as an Amazon bestselling author. So thank you guys so much for tuning in. Thank you so much for being with us, Dr. Stephanie. Everybody have a happy Sunday. Please keep the things that she has stated in mind. Keep your mask up. Ask them to give you 6 feet. And by all means, clean everything. Okay, thanks so much, guys. Have a good day.